Om Dam Dhanvantare Namaha. Karpura Gauram Karunavataram Samsara Saram Bhujagendra Haram Sada Vasantam Hridayaravinде Bhavam Bhuyani Sahitam Namami. Let me share the PowerPoint. So today's topic is clinical indications of Mukta panchamrita rasa, a scientific and experiential view. Mukta panchamrita rasa is a Sudha Vargiya preparation which contains natural calcium, and it is useful in Vata Pittaja and Pittaja disorders like Amla Pitta, Parinama Shola, Chita Pitta, and such disorders. And it is widely used in clinical practice by Ayurveda physicians. So Rasa Shastriya Aushadhis are popularly used by Ayurveda physicians in modern India. These formulations or preparations are cost-effective and potent in action. These are given in small doses, palatable, and also considered as quickly acting in the body. Shuddhavargya Aushadhi is a group of medicines which contain natural calcium as the main ingredient. Mukta Panchamrita Rasa, Pravala Panchamrita Rasa, Kamaduga Rasa, Pravala Pishti, Mukta Pishti, Shankabhasma, Shukti Bhasma, Varatika Bhasma, and Govinda Bhasma are few Ayurveda medicines which belong to the Shuddhavargiya group. According to modern medicine, calcium is one of the major constituents in the body. And calcium is necessary for bone growth, cellular functions, muscle cell contraction, and as an ion which is helpful to maintain the pH of the blood, as a factor necessary for blood clotting and excitation of the cell. Calcium preparations are responsible for neutralizing acidity in the stomach, alkalinize the blood, and bone growth. Calcium phosphate hydroxyapatite crystals are seen in the bone. The hardness of the bones and body framework is due to deposition of calcium in the bones. So introduction. Mukta panchamrita rasa is a Sudha preparation which is commonly used in Pitta disorders like Amla Pitta, Parinama Shola, Pitta Jvara, hyperacidity syndrome, Rakta Pitta, Annadra Shola, and Plehavirti are some of the indications of this formulation. So contents are Mukta Bhasma, Pravala Bhasma, Vanga Bhasma, Shanka Bhasma, Shukti Bhasma, Bhavana of the following like Ikshaswarasa, Godugda, Vidarikanda Sarasa, Kumari Sarasa, Kitavari Sarasa, Tulasi Pata Sarasa, and Amsapadi Sarasa. So ingredients one by one, let us see the actions. Pravala, Madhura Rasekta, Amla Rasekta, Lagu Rukshaguna, Shitavirya, Madhura Vipaka, Tridoshahara, Balya, Deepana, Pachana, Vishagna, Kasahara, Netriya, and indicated in Netraroga, Raktapitta, Kshaya, Kasa, Visharoga, Amlapitta, and Parinamashara. And Mukta, Mukta Bhasma, Kashaya, Madhura Rasekta, Laguru, Snigdaguna, Shitavirya, Madhura Vipaka, Pittahara or Kappa Pittahara, Chakshashya, Vishahara, Hridya, Jwarahara, Mutrala, indicated in Jwara, Nirika, Vyanga, Hridroga, Jalodhara, Kasa, Shwasa, Shlipada, Rajaikshma, Chardi, Hikka, Vatavyadi, Prameha, Unmada, Netraroga, Astidosha, and Nidranasha. And Shankavasma, this Katukashayara Sayukta, Lagurukshaguna, Shitavirya Yukta, Madhura Paka, Kapapit Vatahara, Grahi, Pachaka, Shulahara, Balya, Varnya, useful in Parinama Shula, Amlapitta, Agrimandya, Yavana Pidika, Visharoga, and Grahani and Tasara. And Muktashti Bhasma is Tikta Katura Sekta, Lagurukshaguna, Ushnavirya, Katoyapaka, Kapavatahara, Deepana, Pachana, Grahi, Vrishya, Netriya, Vedana, and indicated in Atsara, Rudroga, Mutrashakara, Pranamashula, Gulma, Shwasa, and Plihara. And Varatik Vasma, it is Tiktakatu, Kashayara Sekta, Lagurukshaguna, Ushnavirya, Katoyapaka, Kapavatahara, Deepana, Grahi, Netriya, Vrishya, indicated in Pranamashula, Gulma, Varna, Karnashula, Grahani, Kshaya, Kasa, and Raktapita. And Angavasma is Shukrala, aphrodisiac, usually useful in diabetes mellitus and spermatoria. So this is Shanka. Shanka. This is Varatika. This is the Pravala Mula, Kural, and this is Mukta Shakti. And now let us see, after seeing the ingredients and its actions, let us see the clinical indications of Mukta panchamrita. So this is based on the textual reference as well as my personal experience in the clinical medicine. Clinical indications are Parinamashola, Amlapitta, acid peptic disease, hyperacid syndrome, Annadrashola, Raktapitta, Udara, chronic kidney disease, isn't it? Pliharoga, splenomegaly, jaundice, hepatocellular jaundice, insomnia, cirrhosis of the liver, gastroesophageal reflux disease, hematemesis, Udadaha, Urodaha, Udaradaha, tetany, that is in calcium deficiency, cramps in legs, and hypocalcemia conditions. Now let us see the Amayaka Praga. Depending upon the different diseases, these specific medicines, it can be given in varied disorders with a very good outcome. Like in Parinamashola, it is given with Bunimbadi Kashaya, Agunatindivati, and Jastikrita. In Amlapitta, it is given with the Hypothekarchorna and Patolakartoronyadi Kashaya. In acid peptic disease, it is given with the, along with Patoladikvata and Shotashekar Rasa. In Annadraushala, it is given with Palatigadi Kashaya, Bunimbadi Kashaya, and Agunatindivati. In Raktapitta, it is given with Ushiradikashapeya, Ushirasava, and Raktapitta Kolakandana Rasa. In Udarroga, it is given with the Puranavadi Mandora, Kumaryasava, and high protein diet and low salt diet. In ascites. In chronic kidney disease, it is given with Varnadikashaya, Tandarprabhavati, Udandivasma, and Gokshar Bijachurna. In Pliharoga, splenomegaly, it is given with the Pravala Basma and Ushirasava and Vahitakarishta. In splenomegaly, it is given with the Nabhivati, Ushirasava and Pravala Basma. And in jaundice, it is given with the Gudichikashaya and Aragyavadinivati. In hepatitis, also same medicine. In insomnia, it is given with the Saraswatarishta and Sarpagandhavati. In cirrhosis of the liver, it is given with the Palatikadi Kashaya, Aragyavadinivati, Pranavadi Mandara, and high protein diet and salt and water restriction. In jaundice, it is given with the Gudichikashaya and Aragyavadinivati. Okay. So these we have seen. So in Budadaha, it is given with Ushirasava, internally, and Shatavari, Grita for external application. Shatavatagrita, sorry. In Urodaha, it is given with the Madhipal Rasayana and Cherakarishta. In Udaradaha, it is given with Madhipal Rasayana and Sutashekar Rasa. In tetany, it is given with Maharasana Kashaya and Balarishta. In cramps and legs, it is given with Yogaraja Gula and Balarishta with good results. In Udaradaha, burning sensation of the abdomen, it is given with Madhipal Rasayana and Sutashekar Rasa. In tetany, with Maharasana Kashaya and Balarishta. So this we have seen, isn't it? In hypocalcemic conditions, it is given with Godandavasma and Pravalvasma. In gastroesophageal reflux, it is given with the Sutashekar Rasa, Bunimbadi Kashaya, and Agnitandivati. Now, after seeing the Amayik Praga, let us see the actions. Depending upon the ingredients, the following actions are seen: antacid, Pittahara, Dahara, Nidrajanaka, alkalinizer, calcium supplement, Kashaya and Katrasvaita, Katuvipaka, carminative, Deepana, Pachana, Raktapitanashaka, Plihari. These are the actions. Now coming to discussion, Mukta panchamrita rasa is a Sudhavargya Kharaliya Rasayana formulation which is indicated in Pitta disorders. Disorders like Amla Pitta, Urodaha, Udaradaha, Udadaha, Shita Pitta, Parinamashola, Annaudrashola, and peptic disorders. Cirrhosis of the liver, hepatitis, ascites, splenomegaly, and bleeding disorders can be better managed by this formulation. It has Pittahara, antacid, systemic alkalinizer, calcium supplement, and hemostatic actions. On prolonged usage also, it will not produce serious side effects. However, it should not be given in patients of renal calculus. Coming to conclusion, Mukta panchamrita rasa is a Sudhavargya formulation indicated in Pitta and Vata Pitta disorders. There is least adverse drug reactions even after prolonged treatment of this formulation. However, in patients of renal calculus, this is contraindicated. With the suitable adjuvants, it will alleviate a number of disorders with the least adverse drug reactions. So in a nutshell, Mukta panchamrita rasa is a Sudhavargya formulation which is useful in Vataja and Vata Pitta disorders. And it should not be given in renal calculus, especially oxalate stones. Otherwise, it has least side effects. So these are the references. Thank you for patient hearing.